Hello, everyone. My name is Nagin, and today I want to talk about hidradenitis suppurativa. Hidradenitis suppurativa, as we've learned in this class, the prefix hydra means sweat, aden means glands, and the suffix itis means inflammation. The second word, suppurativa, comes from suppurate or suppuration, which is the formation and discharge of pus. Therefore, hidradenitis suppurativa means inflammation of sweat glands with pus discharge. This is also called acne inversus. However, many doctors avoid using this term because HS is nowhere near what acne is, and we want to avoid it being mistaken for it. So, what is HS? Although the name suggests that this is inflammation of the sweat glands, this is a chronic inflammatory condition that influences follicular units as a whole. And I will go ahead and show in the next slide what I mean by that. But these are what the lesions and the pus-filled abscesses kind of look like. These images are very forgiving to what the disease could actually look like. I just didn't want to make anyone uncomfortable. However, to go ahead and make this clear, the follicular unit, as we can see here, consists of the hair follicle, the sebaceous oil gland connected to it, the erector pili muscle, and the supporting blood vessels. So once the hair follicle is influenced by this disease, it then tunnels underneath the skin and influences our apocrine sweat glands, which open directly into the hair follicle, and the eccrine sweat glands that open directly onto the surface of the skin. Given this description, the common areas where this disease occurs are the armpit, axilla area, under the breast, inframammary, the glutes, and the inguinal area for both men and women. What causes HS to develop is the next question. And although studies are not completely sure where HS comes from, we have somewhat of an idea, and the main ones include our immune system and genetics. So studies have shown that parents who have this disease are very likely to go ahead and pass it on to the next generation, their kids. And many other studies have shown that different genes, including the gamma secretus family, as well as mutations in autoinflammatory genes, can result in HS, which makes this disease partially an autoimmune disease as well. Before any studies were done, people thought that this was resulting from poor hygiene. This disease can look like skin infection, and sometimes it is a skin infection. However, recent studies have debunked that poor hygiene is leading to HS. So that is not the idea. Another couple of reasons why HS may occur is because of hormonal imbalances. It could trigger inflammation in the body, which can result in HS. Obesity, smoking, and poor lifestyle habits have also shown to cause HS as well. Given this information, it is important for us to note that biological females are 3 times more likely to develop HS than their biological male counterparts. People of color have also shown to be more prone to HS in the United States, and HS is often associated with comorbid conditions. For example, if someone has HS, it's very likely that they also struggle with another complication, including obesity, anxiety, diabetes, anemia, PCOS, IBD, and a lot of other things. Now, the treatments for hidradenitis suppurativa, the treatment for any sort of disease begins with diagnosis. Diagnosis seems to be one of the hardest parts about HS because the disease resembles other skin conditions and it's not something that is very well known. So it's often misdiagnosed until the disease progresses to advanced stages, which are stages 2 and 3. And HS is something that unfortunately cannot be cured. So the goals of treatment include reducing flare-ups, healing existing wounds, and relieving pain and preventing new areas of disease. Some common treatment plans include antibiotic therapy, which, as we all know, antibiotics cannot be continued long-term, and antibiotics do not completely get rid of this disease. Corticosteroid injections can be done directly onto the nodules to reduce inflammation, and deroofing procedures can be done, but none of these are a complete fix. Another treatment that is not recommended but done is an immunosuppressant called Humira. It has really bad side effects and it could have negative effects on the body. So doctors give this to people who have mild to severe HS, but it's not something that works very well. And then the last thing would be surgical incision, which is invasive reconstructive surgery. It's completely different from deroofing, and it has to be done by board-certified plastic surgeons under general anesthesia. And lastly, changes in lifestyle habits, including diet and exercise, not smoking, not eating junk food, and changing lifestyle habits greatly helps this disease. Just to share some extra information for those that are interested, I work directly with Dr. Amir Tahernia. He's a reconstructive plastic surgeon in Beverly Hills, and he is my mentor, and he works directly with this disease, and he does God's work.
This young lady has hidradenitis, and I'm going to show you guys how we helped her out. Just to orient you, the arm is on the top right of the photo, and the remainder is her chest, and that's the breast in the middle. And what you're looking at is the wound has been created with the hidradenitis removed, and tissue was taken from the patient's side here and brought into the armpits. And here's the finished product where you can see the flap fully inset and placed into the armpits, and all the wounds are closed, and you can see that she no longer has disease in her armpit. This young lady
Thank you everyone for watching, and I apologize for going over the time a little bit.